Hello everyone. Today, we're delving into the world of a medication called oxymetazoline nasal, commonly known by its brand name, Afrin, among others. As always, this discussion is meant for educational purposes only. If you have health-related questions or concerns, it's essential to seek advice from a medical professional. Description: Oxymetazoline nasal, available under various brand names including Afrin, is a nasal spray or drops used to relieve nasal congestion. It is classified as a nasal decongestant and works by narrowing the blood vessels in the nasal passages. This constriction reduces swelling and congestion, making it easier to breathe through the nose. Oxymetazoline nasal is primarily indicated for the temporary relief of stuffy nose due to various causes, such as the common cold, allergies, or sinusitis. Warnings: before using oxymetazoline nasal, there are some precautions to keep in mind. It is not recommended for use in children under the age of 6 without consulting a healthcare provider. Additionally, prolonged or excessive use of this nasal decongestant can lead to a phenomenon known as rebound congestion, where the nasal passages become more congested when the medication wears off. Therefore, it should not be used for more than 3 consecutive days unless otherwise directed by a healthcare professional. Before taking this medication, prior to using oxymetazoline nasal, it's important to discuss your medical history and any underlying health conditions with your healthcare provider. If you have a history of certain medical conditions like high blood pressure, heart disease, diabetes, or thyroid problems, inform your healthcare provider, as these conditions may affect the suitability of this medication. It's also essential to let your doctor know about any other medications, supplements, or herbal products you are currently using, as they may interact with oxymetazoline nasal. Side effects: like all medications, oxymetazoline nasal can have side effects. Common side effects may include temporary burning or stinging sensation in the nose, sneezing, increased nasal discharge, or dryness of the nasal passages. In rare cases, individuals may experience more severe side effects, such as fast or irregular heartbeat, increased blood pressure, severe headache, nervousness, or difficulty sleeping. If you encounter any of these serious side effects, it is crucial to seek medical attention promptly. Interactions: oxymetazoline nasal may interact with other medications, especially if taken concurrently with other nasal decongestants or medications containing sympathomimetic agents. It's important to inform your healthcare provider about all the medications you are using to avoid potential interactions. Dosage: proper dosage is essential for the effective and safe use of oxymetazoline nasal. Always follow your healthcare provider's instructions or the instructions on the medication label. Generally, for adults and children aged 6 and older, the recommended dosage is 1 or 2 sprays in each nostril every 10 to 12 hours, but not more than 2 doses in any 24-hour period. For children under 6, it's crucial to consult with a healthcare provider for appropriate dosing guidance. Avoid: while using oxymetazoline nasal, it's advisable to avoid prolonged or excessive use, as it may lead to rebound congestion. Avoid introducing the nasal spray nozzle into the nose too deeply, and do not share the medication with others to prevent the spread of infections. Additionally, it's a good practice to refrain from using other nasal decongestants simultaneously unless directed by a healthcare provider. FAQ: some individuals may wonder about the safety of oxymetazoline nasal during pregnancy or breastfeeding. It's advisable to consult with a healthcare provider for guidance in these situations, as the use of this medication during pregnancy or breastfeeding should be carefully considered. Closing: that concludes our overview of oxymetazoline nasal. Remember, this information is provided for educational purposes and should not replace professional medical advice. If you have any questions or concerns about this medication, please consult with a healthcare provider. Thank you for tuning in.